everyone, and welcome back to the Sex and Wellness Podcast with Dr. Mary. I am here again with Dana Wicker. We're so excited to have you.
Thank you. I'm happy to be back.
You guys may have heard her podcast with me on libido. I believe that it was this third podcast, I believe.
Yeah, I think
or
so.
Or the second. I think it was the second, actually.
It was early on. Yeah.
So for those of you that don't know her, she's a nurse practitioner at River Place OBGYN here in Austin, Texas. And she specializes in women's health.
Yeah.
So, yeah.
All things women.
And again, Maya's in our video. She's just laying here in her little Christmas outfit. All right. So today we're going to touch on a lot of different things that can be helped during menopause. And this can also go for different times of your life that you have low estrogen, such as, you know, if you're postpartum, that can be a cause, or you have history of cancer. So we can kind of or breast cancer, we can touch on some of those things. So overall, the goal of this podcast episode is to help you find resources outside of just pelvic floor physical therapy. So say you've tried physical therapy before, or you've tried multiple practitioners and you're not getting the results that you would like. I like a collaborative approach.
Yeah.
So that way you guys can know like what other options are out there and, seek help yourself. So
That's right.
yeah. All righty.
All right. Where do you want to start?
So I say let's just jump right into vaginal dryness.
Yes. This is a very common complaint. And like you said, it affects women all throughout the lifespan. So it's important to kind of figure out where we are and where, we best should aim treatment.
Yeah, I mean, it's multifactorial too with vaginal dryness. I mean, it's usually can be a pH issue, but in this population in perimenopause or menopause, it's typically due to the decrease in estrogen.
Right.
Can you explain why?
Yeah, so as you go through menopause, it's going to be a slow reduction in your naturally produced estrogen. And most people will think once I have not had periods for 12 full months, you're menopausal, and that's when symptoms start. But they actually start a few years before that. Could be hot flashes, could be night sweats, irritability, trouble sleeping. Those kinds of things can signal perimenopause, which is just kind of that slow transition into menopause. But a lot of people also have problems with vaginal dryness. Sometimes it feels like itching, recurrent UTIs, pain with intercourse, just because the tissue is more friable. It means it just tears easily. It's thinner. It's just lost a lot of that estrogen effect, and it makes the tissue a lot more susceptible to infection, UTIs, pain. So there's lots of things we can do for that.
Perfect.
Yeah.
Yeah. And just to kind of clarify, we're not going to be touching on bioidentical hormones or anything like that. We're focusing more on locally to the vagina and the vulvar area.
Right. Because there's lots of things we can do. Procedures, there's medications, there's treatments. So there's lots of things that we can use to help. So it meets people where they are and what you're looking for with your goals.
Perfect. Okay, so let's just kind of jump in for vaginal dryness. So we'll go hormonally. So there's different options, right? And so one of them that you and I were talking about before was E-string. So can you explain what E-string is and then some of the pros and cons of using E-string?
Yeah, and I know we said we weren't going to talk about hormones. One thing to kind of remember, if you're doing traditional hormone replacement therapy, it doesn't often translate to vaginal treatment. So you could be using it systemically in your body to help with hot flashes, but it might not be helping the vagina. So it's important to remember that. E-string is a ring that you place inside the vagina. It's good for 3 months, and it delivers locally just to the vagina estrogen. And so a lot of people like that one because it's less messy. You put it in, you leave it in there, and it's not like one of the creams that, eventually will come out through the vagina.
Yeah, that, and I've seen people really like that because it's part of it is just forgetting, to insert something either at least a few times a week, and especially if it's not every day, then you're not in a routine, and then it comes out in your undies.
Right. Exactly.
And all that.
This one can be a little bit more expensive, but you have to remember it's good for 3 months. So you just kind of have to factor that into it.
Well, the cream itself is insanely expensive as well.
Yes.
And I could go on and on about that, but I've heard vaginal estrogen is compared to it's like the woman's or people's with vaginas Viagra, essentially, but ours is like a million times more expensive. But that's for another podcast.
Yes.
Just like to make these little side snarky comments. Okay. When somebody's on E-string, do you recommend that they remove it before sex?
They don't have to, but it's just a comfort level. Like anything in the vagina, you just want to make sure that the tissue is healthy. And so if you have pain or bleeding, something like that, you'd want to take it out and assess or come in and see your doctor or just see if maybe the tissue is having some integrity problems, but you don't have to take it out.
Yeah. But when it's put in, people are shown how to put it in and remove it. Or
yeah, it's pretty easy. It's very similar to like the Nuva ring or the off-brand one of that, or like Annovera. Those are flexible rings that are put into the vagina. And most of the time, the problem is like if you still feel it, once it's inserted, it's just not in high enough. So use lube, take your time, but most people do fine. Or use a tampon inserter.
Perfect.
Applicator to put it in there.
Yeah.
Yeah.
So the pros of that are that you don't have to use it every day.
Right. You can just put it in, forget about it, less messy. And some people react just differently. You know, if you've tried one estrogen delivery method and it didn't work for you, or you had increased, yeast infection, something like that, try a different one. It could be just the inner ingredients make all the difference.
I think people might assume like all estrogen is the same too. But like you're saying, even so, like even just with, I'm trying not to say like, shit, I did it again.
It's okay.
Okay. Anyways, I'm going to keep this in the podcast because I want people to know I'm working.
Is real.
I'm working on it. I'm working on it. So no, I got distracted. Okay. So yeah, just even the additive ingredients in different estrogen creams. Right.
I mean,
we're not thinking about that. We're just assuming it's all kind of the same.
Right. And yes, I think you just have to assess how you are before you started, what symptoms you're having. Do we need to change what we're using based on your reaction for those? It's no different than any other medication.
Perfect.
Yeah.
And the cons?
It's expensive. Sometimes it's covered by insurance. Sometimes it's not.
What does it usually run, by the way?
I think I had a patient on it and it was like $375 for the 3 months. So,
I mean, that's cheaper than most vaginal estrogens, about $200 a month, I thought.
They can vary. It depends on your insurance plan, but yeah, it's not cheap.
And then the other con would be potentially like if you are having repeated UTIs, maybe it may not go as close to the urethra.
Maybe so, or maybe it's like insertion of, or maybe the tissue is just really damaged easily, and having sort of an object there is not great. I had a patient with a pessary that had an injury from the pessary. You just have to kind of... You just have to be careful.
Sorry, what I was referring to is more of sometimes when I've seen people on vaginal estrogen, like you and I were saying before, is that the estrogen may not get directly onto the urethral tissue.
True. But right. So if you use a cream, then the cream eventually is going to come down through the vagina, assume that it'll kind of, work its way to the outside, or you use the cream with a fingertip and just kind of spread it on the urethra. That can be helpful too.
Yeah.
So yes, you don't have that option with the estering, but I think most people want it because of the less mess.
Oh, for sure.
So you just have to kind of decide what your symptoms are and what you're willing to put up with as side effects.
Yeah. I mean, it comes down to side effects, cost, and usage, and like what works best for you. Okay. So then going on to the cream. So the estrogen creams.
Yeah. Estradiol cream, it's inserted into the vagina similar to a monostat cream. Easy to do. Recommend doing it at bedtime. When you first start it, you do it for like 14 nights in a row and then move to twice weekly. But there again, pros and cons. Could be hard to remember Tuesday, Friday. It's a little bit more messy, but usually of the options, it tends to be a little bit less expensive of the prescribable options.
I'm laughing because a few years ago, I was dealing, which we'll dive into the pH stuff the changes and stuff, but I was getting a couple recurrent yeast infections and I wasn't thinking, and I put a monostat in and wore like black leggings and went out.
It's a mess.
Oh, it went through my leggings. A significant amount where you can't. I was asking somebody, I said, can you notice? And people are like, you can't unsee it. So that happens to the best of us.
So don't do it. Being a woman. Yeah.
Well, it was just so itchy, and I was like, oh, I want relief before I
Yes.
go out. Was not thinking. So next I should have wore a little pad, but was not
Yes.
thinking about that. So learn from
Plan
my
ahead.
mistakes. I ruined those really nice Spanx. They're like these like sheer, like I don't know, they're kind of faux leather.
Oh, no.
Yeah, that was a sad
Just
day.
take them off and toss them.
I mean, the detergent, nothing took it out. The monostat definitely, yeah.
Bummer.
Yeah. So anyways, pros and cons very similar to the E-string.
Yes. Easy delivery method. Honestly, it's pretty simple to do. If you use a tampon, you can do that, but messy.
Yeah.
Yeah.
All right. So then a procedure. We were talking about the Mona Lisa. So can you explain what the Mona Lisa is and how it helps?
Mona Lisa is a laser. It's pretty quick. It takes like 4 or 5 minutes to be administered, but it's a laser to the vaginal tissue to improve atrophy. And so for those women, atrophy can translate to incontinence, dryness, pain during intercourse. It's a series of 4 treatments. I have patients that have said it hurts. So, it's a laser. They can give you like an anesthetic beforehand, but there can be, some spotting or tenderness afterwards.
Oh, yeah, I'm sure. I've had people that have used it and they said it worked wonders.
Yes.
So I think it can be a great option because it's also non-hormonal.
Right.
So, which we'll jump into the non-hormonal options of vaginal dryness. But how much does a Mona Lisa usually run? Is that covered by insurance?
No, that's the other unfortunate thing is a lot of these are not covered by insurance for various reasons. But usually that's when I'll tell people like start socking money into your FSA or your HSA account because those are great things to use them for, but they're not well covered.
Well, it's also, too, it's one of those things where even if it's covered, half the time it's not even truly covered. I can go,
Yes.
I kind of went on and on about this on my last podcast about how to advocate for yourself and stuff and understanding the healthcare system because sometimes people think if insurance covers it, it's less expensive, but sometimes it's a whole other, you can get slapped with a bill later, but if you start adding up costs, right? So if you are paying $200 a month for vaginal estrogen or $375 every quarter, that adds up. So if you do a Mona Lisa and that helps long term, you just got to weigh your pros and your cons.
Right. And then I think this brings up a good point that in all of these treatments, think about the emotional cost of these. Right? Like,
Exactly.
Is this affecting intimacy with your partner? Are you shying away from sex because it hurt last time? Are you packing extra clothes in your car or in your purse because you're worried about leaking? Are you not going to functions, because you're worried about laughing and leaking? Or, God forbid you get bronchitis and start coughing a lot. So I think it's important to understand these options so that you have information and can decide because I don't think as women we realize how heavy that is.
Well, and then that can affect your anxiety and depression and all these things, which we've almost kind of just been taught to suppress. And then you add on all of this stuff. And especially in our society, if you're an aging woman, heaven forbid, I was talking to somebody the other day. I don't know. Did you see the most attractive man was Miss McDreamy?
McDreamy,
but he's 60.
Yes.
And who was the woman? It was.
Oh, I don't know.
I don't know exactly what it was, but she definitely wasn't 60.
No, she was probably 25,
I think
30.
she was in her 30s, which I'm sure she's beautiful. I have no idea who it is, but it's you think, okay. So adding on all these cultural stigmas and things like that, we have to really consider our quality of life, right? And so, yes, if money and finances are an issue, then maybe, just trying to figure out what works for you and look at the different treatment options and see what works. And then you can kind of go from there.
Yeah.
But emotional toll is huge.
Yes.
I think that I like to think of things like an investment. It's not a price as much as it is an investment. Obviously, people do have barriers financially, but some people don't. And, breaking that down and looking at it from that perspective.
Yeah.
But
I agree.
Alrighty, so some non-hormonal options for vaginal dryness.
Yes. So there's a medication called Osphena, and that one is a pill that goes into the mouth that's non-hormonal and helps with vaginal dryness. Can help with pain during intercourse. So that one's a good one if you are kind of trying to stay away from vaginal applied things. But also non-hormonal, there are supplements. I really like the Bonafide brand.
Yeah.
They have a lot of supplements, but they have vaginal inserts that are great.
The hyaluronic acid one.
With hyaluronic acid, that's really good at restoring some of that tissue. And I put them in 3 different buckets. There's over-the-counter, there's supplement version, and then there's prescribable. And so that's sort of in this middle category. It's a great thing to try if you're not really sure how this will work for you or cost is too prohibitive in the prescribable option. I love Bonafide products, but over-the-counter, Replens makes one that's actually a clear gel that gets inserted into the vagina. That one a lot of people like for first line of defense. It's, very little commitment there. It's over-the-counter and it's a clear gel. So if you are having discharge, it's not quite the problems that we have with some of the other more opaque sort of white creams like estradiol.
That can ruin your
Spanx. Yeah, for sure.
So with that, one of the bigger topics is, so for estrogen or for all of vaginal dryness, right, that tends to be closer, chronic vaginal dryness tends to be closer to perimenopause and menopause ages. But the other topic is if you have a history of breast cancer.
Yeah.
Right? And so obviously talking to your oncologist before anything.
Yes.
But what are some options? Could you say that the Mona Lisa and then
I would say start with some of the vaginal treatments.
The hyaluronic acid?
Well, so yes, that would be a super easy one to try. Yep. But then, some of the treatments like Mona Lisa or Vivive, which is a radiofrequency delivery of energy, those are not applying any medications to the vagina and should have no risk. We have a lot of patients that are post-chemo or post-breast cancer that are choosing to use those. And
did you mention Vivive before?
I think we talked about it in our last podcast, but not yet today.
Okay.
Do you want me to tell you about that one?
The Vivive, we'll talk about the sensation changes.
So that's going to be Cleovana.
Okay.
Yeah.
All right. So let's talk about Vivive.
Yeah, Vivive's great. It's a vaginal treatment. It's a wand that goes into the vagina and it delivers radiofrequency beam of energy into the tissue. And when you have vaginal dryness, your body doesn't really think it's a problem. Your mind knows it's a problem. This is affecting, how I feel every day. I'm feeling dry, itchy, pain during intercourse, but the body doesn't think it's a problem. And so what radiofrequency beam of energy does is it goes into the collagen layer of the tissue and causes micro damage. So it's not something you're going to feel, but it disrupts the collagen layer so that your body is triggered to have an immune response, basically an inflammatory response that goes to the vagina, sends this inflammatory response there, and improves the vaginal tissue. So
how is that different than the Mona Lisa?
So Mona Lisa is a laser.
Okay.
And so they're aimed at doing roughly similar things, but it's just going to be depth of penetration to the tissue and how it's derived. So Mona Lisa is going to be 4 treatments. They're quick. They're like 4 minutes, but 4 treatments. Vivive is 1 treatment, takes about 50 minutes. And they all last different amounts of time. I've seen anywhere from like 6 to 24 months. Unfortunately, they're not permanent, as we age, the time marches on and the tissue is going to continue to age with you, but it kind of rewinds a little bit of time. So I think those treatments are really helpful to do, but it bears mentioning that I always recommend doing a vaginal estrogen before and after the treatment if you're menopausal. For premenopausal patients, not necessarily, but for menopausal patients, you want the tissue to be as supple as possible for the treatment. So even short term would be good.
Yeah, I think that's great. I mean, the other option is if you're absolutely just not interested in any of these options. The one thing that I can mention from like a lubricant side is using a lubricant that you can shoot up. You can use, it's almost like we call them lube launchers, and you can put lube in it and shoot it intravaginally before having penetrative sex. And that can potentially help some of that dryness in that moment if you're, just kind of wanting to start.
Oh, yeah. I
from
recommend
a baseline
lubricant to everybody. Fun fact, women who use lube have more orgasms than women who do not.
Yeah.
So everybody should be using it.
Yeah. And even if, we talked a little bit about this in episode 2. I'm saying it's episode 2 because I think it is.
We'll go with that.
But yeah, just because you have vaginal dryness doesn't mean you're not aroused.
Right.
So that's something to also consider. I think there's a lot of shame around people with vaginal dryness. So you can have vaginal dryness and not be perimenopausal.
Absolutely.
Too. So just kind of touching on that as well. So it doesn't mean that you're perimenopausal or anything necessarily. It's just more that these are options that tend to be more for people in perimenopause or menopause. But yeah, and so that, but then also looking at the type of lube, you know, if you look at some of the, I'm not going to mention names, but a lot can potentially set off your pH that are more, you know, targeted towards men, if that makes sense. And so some of it just depends on your sense, if you're sensitive to certain lubricants and whatnot.
Right.
But do you have a certain brand you like?
Yes, I love Uber Lube.
Uberlube. I love Mod.
Do you?
Have you tried it?
No.
It's great. We also, in the clinic, will use slippery stuff. So a lot of stuff that promotes vaginal pH versus stuff that doesn't even mention it on the labels is going to be important. So, all righty. So leakage. So I think with leakage, it's broken into two parts, right? So leakage can be urinary urgency and or urinary leakage. So what that means is stress urinary incontinence. So if you cough or sneeze and you pee versus if you are running to the bathroom to pee. And so I'm biased. I always think the first line of defense should be pelvic floor PT because I think a lot of people actually do pretty well, or what I've seen is just even understanding their anatomy, how to breathe to relax their muscles, how to contract, looking at a bladder diary, looking at their bowel and bladder diary, what they're eating, what they're drinking, and then if all of that, and then understanding their body from a pelvic floor perspective, like pelvic floor strengthening, but also understanding core strength and how that affects it. If it's with certain activities, assessing those activities and seeing if other parts of the body are involved. So we're just assuming that, you know, and you can do whatever you want, right? If you're like, I'm not interested in pelvic floor therapy. Okay, it's your body. I want you to understand that there are these resources for you as well. So I think the combination of both is great. But again, if you're not wanting to do it, these are also options as well. So with urgency, so that's running to the bathroom, what are some of the medications that you guys typically prescribe?
For that, I mean, it's usually like a contracture of the dome of the bladder, and it's like, I have to go right now. Those would be anticholinergics. So this would be like ditropan or Detrol. And they work pretty well, but there's a fine balance there, like with most medications, because they can cause other side effects like constipation, dry eye, dry mouth. So then, you know, theoretically you're drinking more, you know, it might be compounding the problem. But so those, you kind of have to find a good balance for you.
Yeah. I also think too, is that there's some people that are on other medications that cause the urgency. And so maybe pelvic floor PT doesn't necessarily work as well, or somebody maybe with bladder cancer and had to have, you know, radiation to, you know, that can affect all those different things. So there's also options along those lines. All right. And then you wanted to go more into, were there any other medications or things that you suggest?
For urgency and for stress incontinence, I think, you know, it's a charged topic, but considering weight in that equation is important to look at. We know that people who have higher BMI or are carrying extra weight, it's, again, part of the puzzle to say, like, did this get worse with extra weight? I think it's worth looking into to see if some weight reduction can help take some of the strain off of the pelvic floor muscles. And then smoking is another one that you want to look at too. Smoking is an irritant for the bladder, increases your risk of bladder cancer, but it's definitely one that if you are a smoker of any sort, it's helpful to reduce that, see if that improves your symptoms at all.
Yeah, and we were talking about the weight information because it is an emotionally charged topic. Because also BMI, I'm a little biased with BMI because I've always been considered overweight. And I'm like, okay, but you're not including bone density or muscle mass. But overall, it may be something to consider if you did start leaking and maybe you put on 20 or 30 pounds in the past 6 months or a year, right? So we're looking at different things that have changed as well. I think the issue in healthcare is that people go immediately just lose weight and everything's going to go away. And that's not what we're saying. We're just saying it is something to consider.
It can be part of the puzzle.
It can be part of it. It doesn't have to be all of it. And so that's something that I think is important to talk about because, you know, there's a lot of push on people that are in bigger bodies to lose weight. And, you know, sometimes that isn't always the issue, but it's definitely something to consider.
Something to consider. Yeah.
And so smoking, potential weight loss. You were going to talk about urethral bulking.
Oh, yes. Urethral bulking. Thank you. And I did think of, one other thing that you touched on too is just bladder irritants in general. So alcohol, caffeine, those kinds of things, just considering the diet in there. Urethral bulking is a procedure that's done at your doctor's office under a local anesthesia. It's pretty quick, actually, but they inject a synthetic material around the base of the urethra to provide constricture there. So it's pretty immediate. People have really good results with it. It doesn't last forever, just like everything else, but anywhere from like a year to 2 years for that one. Again, under local. So a lot of people wonder about pain control during that, but that one's a great option for non-surgical.
Yeah, and also pessaries as well. So PTs now in the United States are able to assess and provide pessary fittings as well as OBGYNs in the OBGYN world. They've been doing it. But the thing about that is think of a little small disc that you put intravaginally, and that can hold up, and almost there's a little knob on the end of the ones that are particular for incontinence. And so when you cough or sneeze, think about your urethra as like a tube. It's putting a kink in that tube so that way you're not leaking. And that can also take some of the pressure off the pelvic floor muscles and allow the ligaments that connect to your pelvic organs to shorten a bit, so that way it helps take off some of that stress, especially if you're newly postpartum as well, because everything's kind of been pushed downward. So that's an option. But if you are perimenopausal or menopausal, it's important that there's vaginal estrogen with it, because that can cause irritation in the skin. And so you don't want to prescribe that to somebody that is constantly having that, because it can potentially cause infection or irritation.
Right, or skin breakdown.
Yeah, so that's a big concern with pessaries, is not having the estrogen if you're perimenopausal. So again, these are more of in-office procedures or medications. And the one that an estrogen too can indirectly help.
Yes, estrogen I think is definitely worth trying. And again, we've talked about this before, but layered approach to this is great.
Yeah.
And so if you're considering a treatment, try estrogen for a little bit first. You would probably need the estrogen anyway for the treatment. Try it, see if that's just the thing that you need. If not, add the treatment in and kind of go from there. I think the other thing we want to talk about was Emsella.
Yes.
Sella seat is a magnetic delivery of energy to the pelvis to improve incontinence. And it's a seat. You just sit on it. So this would be really great for people who have, in their history have some trauma or are uncomfortable with being undressed or that vulnerability piece of it. So you are fully clothed and you just sit on a seat, and it's about 30 minutes, and you do 4 treatments over a 2-week time frame. But I think they say like 10,000 Kegels equivalent.
Yeah, there's debate on this in the pelvic floor world. But I think the biggest thing is what you're saying is, I think it's important for people that don't want to do pelvic floor PT. They don't want to get undressed.
Yes.
They don't want to take medication. Like it might be a great option.
Yeah. And I think that's the thing is like what fits best for you.
I don't like to, that's the thing is like, I don't tend to, I mean, certain things, if I truly believe they're harmful, but I think if the worst case scenario, you shell out a bunch of money, which is still a lot, right? But if it's not harming you and you have the funds and you want to try it and you're not comfortable, right? It may be a great option,
Agreed.
So, good.
Yes.
Oh, the other thing too with the urgency is even the estrogen on the urethra can potentially help with that. And then just thinking about what estrogen does to muscles. So we need estrogen to build muscle, right? And so that's why sometimes when you go through menopause, you tend to feel softer. I know after chemotherapy, I all my estrogen, I felt really soft and puffy. And I was like, this is interesting. And then as thankfully it normalized, but it did take some time. And so think about the atrophy that's happening in those pelvic floor muscles too, and that can potentially help with even urgency and leakage.
Right. And I think the other thing to touch on in that whole realm with the estrogen waning and menopause, a lot of people have recurrent UTIs. And so vaginal estrogen is something that a lot of urologists will prescribe as well.
Yeah.
Because it improves the tissue quality, it improves your ability to fight infection because the integrity is improved.
Yeah, I think that's huge. If we're not looking at ruling out a UTI, right? And the other thing is what's interesting with UTIs is if you even have a family member or somebody around you in the population as we age, would you say with the signs of early dementia, or what is it when one of the signs of a UTI in somebody that's older
is a mentation change, like the level of consciousness change.
Yeah, and
sure.
so people might think, they're getting older, but no.
If they get acutely confused, that's always something you want to look at for the elderly is a UTI.
Yeah, I don't know why I couldn't get that word out.
Well, but I think you're right. Like we just, at some point in our culture, we just assume that people are not sexually active, so we're not even going to ask them about their vaginal health. And that's the exact wrong thing. I mean, just because you're 80 and not sexually active does not mean that we don't need to pay attention to those symptoms. I have women come in all the time that feel like they either have a yeast infection or a bacterial infection or UTI, and it's dryness. And so I think, unfortunately, they sort of get shifted off and
totally
it's not even asked about. So
yeah, they're assuming they don't have sex. I'm sorry, I want to be having, if I have a partnership, well, actually, whatever, if I'm 90 in the nursing home, you know, like
even by yourself,
even by myself, whatever, you know, it's something
it's an important part.
It's an important part of people's livelihood. And I've had people that are in their 70s and 80s having the best sex of their lives because they're just like, I don't have these stigmas and I'm just going to have sex.
Right.
And so I think that is a big thing that we're ignoring in healthcare is assuming, especially with women, assuming over a certain age, your vagina is closed for good.
Right.
Closed for service.
When you actually want to keep it healthy and keep it working, because you can have problems where like the tissue starts to become contracted and then you have pain and then you can't have sex. So
yeah.
Use it or lose it.
Yeah, but also like even when they have that too, so say you've gotten to that point, there's no hope.
No.
There's a lot that still can be done, but also understanding that there's a lot you can do.
There is.
And alrighty. Okay. So pain with sex, from a pelvic floor PT standpoint, we're looking at a variety of things with pain with sex with like initial and deep penetration, dermatological changes due to estrogen, which can cause irritation at the vaginal opening, pain with deep penetration, or pain with both. And so from our standpoint, we work on, helping improve the tissue through learning how to relax the pelvic floor muscles, hip mobility, thoracic, mid-back, if there's pain every time you have sex or just sometimes, looking at your central nervous system and seeing if you're in a fight or flight response. So all of those things can affect your ability to have penetrative sex. But in addition to that, we want to talk about also the sensation changes. Yeah. A lot of women say that, or people with vulvas will say, my vulva, or I don't have as much clitoral stimulation or sensation, even with stimulation, and I just am not.
It's not feeling the same.
And then that is another shame, guilt spiral on top of it. And so let's chat about
sensation with it. Yeah. So as we age, the tissue changes just like everywhere else in your body. And I like to equate it to, most people by the time they hit 80 have some amount of hypertension, right? And we know that a lot of people, it's due to hardening of arteries and the vessels themselves just become a little bit less compliant. They don't move as well as they should. Same thing happens with the vulva. And so again, another equivalent would be like male erectile dysfunction.
Yeah.
So how many men in their 50s and 60s have erectile dysfunction?
Yeah.
Quite a few, right? And so the tissue aging happens in women as well, but also through childbirth, weight gain or weight loss. Some people have autoimmune disorders like MS. Those kinds of things can greatly impact your sensation.
Yeah.
So if you think about it, if you're having less sensation during sex, it's harder to get to orgasm. It's going to impact your libido, right?
Oh, and pain. Yeah.
And pain, yes.
So essentially you're just going to say, I'm not going to do it.
Right. And so it's just kind of the snowball where then, like you said, it becomes sort of the shame thing. And then maybe it becomes a wedge in a relationship because we're avoiding sex, and then partners kind of taking it personally, but it's just because it's hurting or not satisfying. So there are certain treatments that can help with that one. One of them that I love is called Cliovana, and this is aimed at improving blood flow and nerve generation to the clitoris. And it hits all parts of the clitoris. I wish I had brought my clitoris model, but
I have a pelvic model, but it won't show clitoris.
The clitoris, actually, most people think of it just like right at the clitoral hood, which is, the happy button for most people is what they think of it. But if you saw it, the clitoris actually goes all the way down both labia, down towards the perineum.
Like a horseshoe.
Yes, and it's just quite amazing. It has more nerve endings than the head of the penis, which is amazing. So we should be using all of these.
Use all of the clitoris.
That's right. Not just part of it. So Cliovana will target treatment for all parts of the clitoris to improve blood flow, make that nerve generation return. And again, it's sort of similar to the Vivive, where it's causing micro damage to the collagen layer to cue the brain, like, let me come in here and bring more blood flow to that area. So it makes orgasms easier to get to, more intense, reduces pain with intercourse, and all of those things I think are libido improvers, right?
Yeah,
which is
sure.
What, a huge majority of my patients come in complaining about is reduction in libido as they're aging.
Yeah.
So it can be a multifaceted
totally
treatment.
Oh yeah. It's completely multifactorial. We can't look at things separately when it comes to the vagina and vulva, because there is a psychosocial, there's a psychological, there's medical reasons, there's relationship changes, stuff like that. But also I've seen, even just with estrogen, people find that using vaginal estrogen has helped their sensation as well.
Yeah.
So if you can't tolerate estrogen, maybe this could be a good option.
It's an awesome option. Like, the only two contraindications are pregnancy and a pacemaker. So
a pacemaker? Why does that?
Just because there's electrical current going through, and they don't want, I think, theoretical risk there.
That makes sense.
But it's a great non-hormonal option.
Yeah. That's good to know.
Yeah.
Perfect.
Yes.
So is there anything else that we've not chatted about today that you wanted to touch on?
I think the other thing we were talking about earlier was pH.
Oh, yes. Let's dive into the pH. So you had some really good tips that...
It is a common visit. I mean, probably 10 times a day, we have patients on my schedule that come in with pH imbalance. So in the vaginas, there's a healthy balance of both yeast and bacteria that are supposed to be there, that keep each other in check. But if one or the other gets out of balance, you either end up with a bacterial infection or yeast infection. And so itchy, sometimes odor, discharge, and it can be sometimes hard for people to discern what's what. And there are home treatments, but oftentimes I don't see people using them correctly. So pH is also one of those things that, unfortunately, if you fix it once, it doesn't mean it's not going to be out of balance. The vagina is a fickle little creature sometimes, and you can have it perfect, and then the next day things change. So I think one of the things that we were sort of laughing about is, you don't realize all the things that impact your pH. And of course, we know that we're not supposed to be using harsh soaps, but...
I don't think some people know that, though. I think a lot of people don't know because it's not talked about.
Well, let's talk about it.
Let's talk about it.
So
just vaginal hygiene in general.
So vaginal hygiene, some people just use water, but it's important to get in there, water on just the outside.
Spread the labia. I'm doing like swimming motions
You have
here.
to get in between the labia and cleanse with water. Water is great if that works for you, but some people produce more skin cells and more discharge. And so if that's not cutting it, or you feel like that's not cutting odor, CeraVe face wash is great. It's pH balanced. I'm going to throw a specific one out there, but CeraVe is great. They're hydrating face wash. Most people have it in their bathroom anyway. Safe for the vulva. Important to note, you never clean inside the vagina, but just in between the labia and on the outside. That one's good. But I think also just kind of considering what is happening in our daily life. We are a legging society. So it's important to just...
As I'm wearing leggings, I have a yeast infection now. No kidding.
Yeasty. Let your lady breathe. So if you're at home, yes, please.
I'm going to uncross my legs.
If you're at home, or like you live in thong underwear can invite bacteria the wrong way. You just want to kind of be careful of that. If you are a spin class person and you're just on that seat, and then you go about your day and you're running errands, some people have to change immediately when they're done working out. It's a pain.
I would say anytime you're sweating profusely, change your undies.
Yes, just it is one of those things that can just kind of trap bacteria. But then also consider intimacy. So sex is a giant mixing of bacteria. Even if you're using condoms, you think about the amount of touching of skin that happens. And for people that are heterosexual, semen has the same pH that bacteria loves to live in. It's a pH of 7, and guess what? That's where BV loves to be, is at a pH of 7. So for those people, we'll oftentimes recommend using condoms for a few months and just sort of let your body reset. Homosexual women tend to have more BV than heterosexual women. So it just kind of depends on what your situation is. But one of the things we were sort of pondering over earlier was, sometimes I'll just tell patients, like, does your partner wash their hands before intimacy?
Before a hand, like if that hand has been in a bag of chips and
anywhere.
it goes directly into your vagina,
think about all the things we touch.
leave them. No, I'm kidding.
Think about all the things we're touching.
They're just not thinking about it.
Or if your partner is not circumcised, important. Have they pulled back the foreskin and really cleansed underneath it? Like, that is a giant trap for bacteria. But the other thing is beards. How many guys have beards now?
Yeah, they're down there munching around.
Go into town. But think about all of the times that they touch their beard.
Yeah.
Every guy I know that has a beard is constantly touching their beard.
Or there's food in it.
Right. So I feel like women in general are better about washing your faces. Not always, but I feel like, we have a little bit more.
There's more bacteria floating around in a beard, I'm sure.
So
we should go around and do like a study, like around downtown Austin, just start swabbing men's beards. Like, you look like you cause pH issues, sir.
Run a pH on everyone's beard. But important to consider. So, make it a thing. It is not one person's fault about BV.
No.
This is, it is kind of one of those things that happens very often. So consider all those parts of the puzzle.
Well, even if they're not circumcised, and say like you guys, did a spin class and then things get hot and heavy when you get home, or maybe not hot and heavy, whatever. The point is like shower, wash off your penis, wash off your vulva. That will hopefully help.
It doesn't have to be like a sexy killer. Like, you can take the shower together.
Yeah.
I mean, but it's
like, clean my vulva. It's like foreplay.
Here's
right
my
labia,
survey.
left labia, perennial body.
Yes, get it all.
Like, what's that?
Get it all. Yeah.
Oh my gosh, I'm glad we ended on this one because it's such a fun topic.
Yeah, I mean, it is wildly common.
Oh yeah, but also even when you clean it, try not to use a wash rag, the vulva.
The tissue is very sensitive.
Yeah, or loofahs.
Yeah.
And even with soap, like you were saying, the unscented. So even being careful, like scented ones, right? So I think, especially if you're on your period and you just want to, wash the area more. There's also pH balance washes too. I know that Good Clean Love has some. So if you want to get stuff specific to that. But those are, that can also cause pain with sex too because of the
dryness. And one thing, just to throw it out there with the pH, over-the-counter boric acid. I'll have a lot of patients that'll come in and say, I think I had BV, so I used boric acid a couple times, because it is marketed to women and it just says to regulate your pH. And I think it's a real disservice for women because that is for recurrent yeast infections. And so you just want to kind of be careful that you're using what's supposed to be used for what problem you have. And if you're not sure, don't be embarrassed. Just come on in and get evaluated.
Yeah. But the hyaluronic acid, would you recommend that?
Yes. That's
regardless
great.
of BV?
Yes, that's going to help to provide moisture to the vagina and can keep tissue as healthy as possible, which in turn,
because I found
can fight
sometimes if people don't have BV and they use different types of things, it can burn.
It can.
So the hyaluronic acid would be a nice...
Yes. It's a vaginal moisturizer.
Yeah. Don't use the kind that you use on your face.
No. Please
don't use it on your face and then use your same hands to put it on your face. Then you've got yeast on your face.
And wash your hands. If you're putting in a vaginal application, wash your hands.
Yeah.
Makes sense, but...
Totally. It all makes sense. Well, thank you so much. It's
My
always
pleasure.
a pleasure. And Maya's really participated in this conversation.
She's very relaxed with this topic.
So we will add your contact info to this, and maybe we'll chat again soon on here.
Looking forward to it.
All right. Thank you, guys.
Bye.